for the girl child and for the mother. They will go to health, what the girl requires from the health facility. They will go to, a moment. They will go to re-entry to school when they've been unfortunate to get pregnant and they need to go back to school. They will also talk about the child care and protection services. Because beyond getting pregnant and dropping out of school, the girls still need care. Who cares for who? Who cares for this baby of a 13-year-old? When we talk about re-entry to school, where do we put this baby? And how do we keep the 13-year-old in the docket of a child so that she's not stigmatized? And how shall we protect this girl from getting pregnant again? Because some of them, it is true, may have been raped, but others don't know what they are going into. They just find themselves in the middle of the struggle. We shall look at the role of the health sector to talk about prevention and response for the girl child. And during the discussion, we shall have opportunity to touch some aspects of psychosocial support and care. Because after getting pregnant at 13 and you deliver, if you are lucky to remain physiologically normal, then you need a lot of support so that you remain a child to your parents and to the community, but you accept the role of becoming a mother. We shall also talk about the justice, law, and order sector and the services it should offer to these girl children, starting from the Uganda Police, ODPP, and the rest of the JEROS subsectors. Regarding the perpetrators, we shall need to also talk a bit about the Uganda prisons. Because when you are a perpetrator of violence against a child, then time may come and you find yourself being handled by that section of the government. So we are looking, in summary, at the girl from childhood, through socialization, through going to school, through dropping out of school, through trying to enter school again, while benefiting from all the holistic services that government offers to the citizens. We implement the gender policy, the GBV policy, and the ending child marriage plan under the multi-sectoral framework. So as a result of the multi-sectoral framework, every stakeholder has a component or a role to play, and that's why we are holding this symposium in partnership with ActionAid Uganda. ActionAid Uganda is one of those key child-focused civil society stakeholders. They tackle a bit of women's empowerment. They tackle some components of GBV, but they are child-focused. ActionAid is child-focused. I worked with them for 7 years before joining government. And their nucleus is the child, even a one-day child. So the additional support in the way of expanding the scope through what we call the ecological model of social work and social administration is to build on what they have already started on But in essence, they are a child-focused organization. May I recognize the Country Director of Action Aid? Please stand up. At the earliest opportunity, we shall introduce Mr. Ejoy. We are doing this in partnership with him because we know we cannot get to the grassroots alone because ActionAid has a grassroots component and they exist and work in a number of districts. So that was the background. Now I can read the objectives specifically, which I believe were on your letter of invitation. Return the objectives of the symposium. I was just talking. Good. The first objective of this activity is to provide an opportunity to the pregnant girls and child mothers to share their experiences with us on how they are managing teenage pregnancy, how they are managing motherhood, how they are managing access to services. And it's at this point that we shall need to critique ourselves and know whether we are providing the services that they require. Number two is to provide a platform for us. This is the most important. To share our evidence, to share our experiences, to share our innovations on supporting service provisions. What works for these girls? What doesn't work? We want to step out of theory and concentrate on what works. What are the existing gaps in service provision? Because we are the social sector ministry, and we want a criticism of what we do, what is working and what is not working. And then what should be done to eliminate teenage pregnancies and child marriages. And where they have already happened, what can be done to address the service gaps, to allow the young mothers to remain children because they are children, to support them and their babies to lead a meaningful life without discrimination and stigma, and then to enable them finally come back and pick up where they dropped from and be able to achieve something for themselves, to go back to school and complete, to go and get employment, and even then to have the capacity to look after those young children that they have delivered. So we have a big role, much as the objectives are too, we have a big role of ensuring that the child mothers get back home, get back to school, remain normal, fit in back in their communities, get reintegrated, and do not drop out of the development cycle, because we can easily drop them if we are not careful with what we do. So ladies and gentlemen, that is the essence of this small presentation that I've given you, to be able to know where we are coming from and to be able to identify where we are going so that our daughters can remain meaningful members of our societies, and that our service delivery systems may be analyzed to know where the gaps are, and then we programmatically work towards closing those gaps. I thank you very much.
Very good. Thank you, Madam Annette, for a very brilliant objective setting for us. Ladies and gentlemen, please join me in welcoming our next presenter, Lydia Wasula from the Department of Youth and Children and the Ministry of Gender, Labour and Social Development. and she's going to be talking to us about the progress on the implementation of the national strategy to end child marriage and teenage pregnancy in Uganda. Lydia, the floor is yours. Let's give her a round of applause as she makes her way here.
Good morning, ladies and gentlemen. My name is Lydia Najemba Wasula. I work as a Principal Probation and Welfare Officer in the Ministry of Gender, Labour and Social Development in the Department of Youth and Children Affairs. I'm waiting for the IT. Yeah. We launched last year in Botaleja on the Day of the African Child. You will recall that this is the second strategy that the country has developed to end child marriage and teenage pregnancy. The first one was launched on the Day of the African Child in 2015, and it expired in 2021. So last year, we came up with another strategy after conducting an assessment of what we had been able to achieve and where there were still gaps. So this is the status of implementation that I'm going to share with you, starting last year when we did launch it up to present. Oh. Next slide. I wish we had capacity to move our slides. Okay. That one I've already mentioned, so we did launch on that day, and we got a lot of commitments from partners, political and technical leadership throughout the country for the implementation of the strategy. These are some of the key objectives of our strategy. We are looking at promoting an enabling environment for the girl child and boy child in Uganda in order to end child marriage and teenage pregnancy, but we also want to influence changes, to influence the dominant thinking, mindset change, especially about the girl child, in the line of the negative social and cultural norms. Frank, I'm not very comfortable. I want to change this to look this side. I thought we would have a screen here so that the presenters are able to follow up using their own screens. Okay, but it's not showing what I want to see. It's instead showing pictures of the participants. Okay, sorry about that, but I had to speak out so that I'm not suffocated. Yes, as they organize, I can try to strive from here. We are looking at developing and strengthening institutional, community, and family systems at all levels. At all levels, right from the community level, from the parish level, child protection systems that will protect children. But we also want to improve the legal and policy environment, especially with a focus on child rights, to protect children from child marriage and teenage pregnancy, and also to strengthen the family. We all know that children are supposed to live in families. They only live in institutions and elsewhere as a last resort. But we all expect children to live in families. Next slide. I don't like this. Okay. In terms of teenage pregnancy in our country and childbearing, that is where we are. We are celebrating a reduction of 1% from 25 since 2016 to 24% as per the UDHS that was released this year. We have reduced up to from 25 to 24%, meaning a percentage of women of age 15 to 19 years, just that, the teenage girls that are already mothers, all pregnant with their first child. We are at that percentage of 24%, a little improvement from the UDHS of 2016 and back to 2011, because in 2011 we were at the same statistics of 24%. In the rural areas, it is still bad, but when you compare notes, that's where we are at 24%. 24% is still very alarming to all of us. Hope we all understand. So despite all the efforts and interventions we have put in place, we are still doing as bad as that. Next slide. Yes, I tried to extract some statistics from the South 116 of the number of children that report forced and early marriage from their parents and caregivers. The children go in corners, pick up calls, and call the Uganda Child Helpline to report. Those are some of the statistics. Masaka, 7 children reported. Children reporting themselves to South 116. Not community members, not family members, but children themselves reporting. My mother is forcing me to do this. My dad is forcing me to get married. My caretaker, my singer, my uncle. Those are some of the statistics. It is still bad, but what does this mean? The numbers may look a little low here, as in 20, 30, 23, as we can see, 19. But this is not small at all. Remember, not all children have access to mobile phones. Not all of them can report. Remember, not all children have that knowledge of the South 116. Despite the awareness we have created, not all of them know about it. But also the courage it takes for a child to pick up a phone and call to report a parent. It doesn't come easy. So these are not mean numbers at all when you analyze the case. All right? It's not small at all, but it gives us some hope that the children are learning and are appreciating that we have the 116 where we can report our cases. Despite the different structures in the communities, we know so many go to the communities, to police, to the senior women teachers, to the LCs, but those who report through the Uganda Child Helpline, these are the numbers that reported in 2022. Next slide. Okay. So I'm going to try to share with you in terms of the strategic objectives, what we have been able to achieve under each strategic objective. In terms of promoting an enabling environment, child marriage has become a national concern. I'm very happy that we have our Honorable Member of Parliament here. Parliament is in for ending child marriage. We have seen so many interventions from WOPA. We thank you, Madam Chairperson. We have seen a lot of work you're doing. It is integrated in the NDP 3, and we pray it is again prioritized in another development plan that will come forward. So it is now a national concern for all the political and technical leadership in this country, even the religious and cultural. So to us, that's an achievement. Everybody is appreciating, all the key stakeholders are appreciating that we must rise up to end child marriage. It has been prioritized by several ministries, departments, and agencies. I had my colleague Frank introducing Minister of Defense here. Thank you so much for being part of this. Minister of Education is here. Ministry of Health is here, Uganda Police Force is here, and many other sectors. So they are all prioritizing ending child marriage in their interventions. Because ending child marriage and teenage pregnancy is not a one-man's show. You cannot sit on an island and end it there. No, you have to work as a team with other stakeholders from different sectors. So we appreciate the fact that we've been able to achieve that all sectors are joining hands to end child marriage and teenage pregnancy by implementing different interventions within their mandates. Yes, again, like I've said, at sectoral level, at central government level, but it's the same story with the districts. In the district development plans, where we have been able to disseminate the strategy, where we have been able to disseminate the national child policy and establish the structures, the interventions to end child marriage and teenage pregnancy have been integrated in the district development plans, in the work plans of our partners, in the programs, in the budgets, so that we appreciate. We have held very high-level dialogues at different levels with key decision makers in this country, including the First Lady herself, who has taken up the mantle to lead, to be an ambassador for ending child marriage and teenage pregnancy. The Prime Minister, the Speaker of Parliament, and so many others, including at regional and district levels. We have strived to promote positive media reporting. Reporting about child marriage in the media is one thing, but reporting positively is another. How do you write your story? How do you air the stories of child marriage? How do you create awareness? We have had several engagements with the media, and we are happy to report that the picture is changing, the image is changing. Before that, we used to see children's pictures being published in the media, children being blamed themselves for getting pregnant through some media houses, but now the story is changing in the positive direction. Next slide. Yes, in terms of influencing changes and working on mindset change, positive mindset change, as far as the social and cultural norms are concerned, we have implemented a national campaign to address defilement, child marriage, teenage pregnancy, and promoting positive parenting. This we did under the leadership of the First Lady, like I've mentioned before, and it had all sectors, all ministers of the key sectors on board, and different partners, including the UN agencies. UNFPA, UNICEF, UNHCR, UNDP were all members of the task force. We implemented the campaign. It was a 2-year campaign, and we see some positive change already reaping from the campaign. We have also implemented a multimedia campaign against child marriage and teenage pregnancy in some parts of the country. For instance, just to mention out, we have had a campaign running in Busoga. We all know what is happening in that region when it comes to child marriage. Yes, we have had a campaign with support from Plan International. We have had campaigns in the Central region with support from World Vision. We have had campaigns in the Northern region with support from Save the Children and many others, running on the media to promote positive parenting, ending child marriage, cautioning the girls, creating awareness. Yes, they have been running, and we feel we are doing something in terms of mindset change. We have had different engagements with culture and religious leaders. Right now, our colleagues from the Department of Family and Culture are in northern Uganda. They have been at it for the whole of this month, conducting different dialogues with cultural leaders. So far, they have successfully conducted in 9 cultural institutions of Buganda, Busoga, Lango, Acholi, Bugisu, Bunyoro, Toro, on ending child marriage and teenage pregnancy and promoting positive parenting. So they are like kind of training of trainers. After training the cultural institutions will cascade with the message downwards, because they will now know what to say, how to package, because the packaging is very important. Next. In terms of strengthening institutional, community, and family systems, we have recruited and deployed 67 social welfare officers in 9 districts, in Karamoja, Tororo, and Arua. And these social welfare officers are placed at the sub-county level. Because the CDOs are overwhelmed with a lot of work, they are in charge of community development, we recruited these with support from UNICEF to back up the community development officers, and their main roles and responsibilities rotated around purely case management, child care, and protection. That was with support from UNICEF. Unfortunately, that funding has ended. We are looking forward to, we are writing proposals, concept notes, and lobbying for more funding. And we have been able to secure the support of Save the Children. Through support of Save the Children, we are recruiting another 17 social welfare officers in Arua, Omoro, Amuru, Kotido, Nabiratuk, with support from Save the Children. They have started work just this week on Monday. Yesterday, that's when they started work. So they are going to be supporting the CDOs at the various sub-counties. In the districts of Kasese and Bunyangabu, we have been supported by Kyagalanyi Kofi, again to recruit social welfare officers to support, in a few sub-counties, 6 sub-counties, to support the community development officers to handle issues of child care and protection, including case management. We have trained over 4,000 parasocial workers in the districts of Kotido, Nabiratuk, Nakapiripirit, Dennis is there, Moroto, Kabong, Omoro, Nwoya, Amuru, Arua. Right now the team is in Chiriandongo training. We have trained in Ramwanja, we have trained in Isinjiro. We are doing several trainings. And these parasocial workers are the lowest community structures that the social development sector owns, that is responsible for. They are responsible for conducting home visits, identifying cases, referring cases to service points, but also liaising with the CDOs on issues of child care and protection. They have done us so well in terms especially of identification of cases. We have got so many of these parasocial workers calling the Uganda Child Helpline themselves when there is a marriage that is about to occur, a child marriage. One parasocial worker sometime about 3 years intercepted a wedding in Butambala of 2 girls, one of 14 years. I think you saw that over the media. One of 14 years and another of 15 years. The father was wedding them off at that age. Same father, they were children of one person, and he had decided to wed them off. But when the parasocial worker learned of it, he called the Uganda Child Helpline. The helpline swung into action, and the marriage was stopped. So the girls were not married off. So they are really doing us great. They are because they are community-based, they are doing a lot of reporting to the probation officers themselves, because you will appreciate that we have only one probation officer. In most districts now have 2, the senior probation and the probation officer serving a full district. So they get overwhelmed, but also the distances. So these parasocial workers are acting as a linkage between our staff at the district and the sub-county and the communities. We are implementing what we call an early detection tool. This is a tool that is exercised on households to identify households that are at risk. We had a case in Mityana where this early detection tool was exercised, and after filling the form, the parasocial worker realized the children in the household were not safe. They were at risk of any abuse, any form of abuse, including child marriage and teenage pregnancy. Why? They were staying in a one-roomed house. These were girls of 12 years, 14 years, with their siblings, one of 9 years, 7 years. They were staying in a one-roomed house with their mother. Their mother was a single mother. The dad had since deserted her. But the mother was a seller of tonto, this local brew. So she had in her one-roomed house, it was separated by a curtain. The bedroom was separated by a curtain. This is the bar, and just the curtain, that's where they all used to sleep. But this woman used to operate her business up to midnight, up to 1 a.m., and the children would keep awake up to that time because they had to wait for the bar to close for them to sleep in the sitting room in courts because it was one room and being separated. So the parasocial worker identified that these children were not safe because what happens when those men get drunk? You know? Even the mother herself would get drunk at times. You know, when you're operating such a business, you also have to drink as a way of enticing your customers, you know, those local brew sellers in the communities. So these children's lives were at risk, so the probation officer had to come in and intervene and stopped the mother from operating the business within the same household. She had her reasons, that's the only place she couldn't, but somehow they found a way and put her together with another business, so they shared room, and the children were left comfortably in their room. At least it became safer, but it also called for close monitoring, which the probation officer did, and eventually some of the two girls were even connected to areas of support, and they were supported in school. One girl was taken to boarding school, so that's how the detection tool works. We have continued to execute our mandate of building the capacity of the social service workforce at all levels, including at central level, central government level, but also cities, district local governments, and even sub-counties. In this period alone, we have been able to train 40 probation and social welfare officers and CDOs on case management, child protection, and online child exploitation and abuse. So all that training is aimed at ending violence against children, including child marriage and teenage pregnancy. We are currently doing a pre-testing. We are developing a system, what we call a child well-being management information system, because on many times we have found ourselves stuck with data. We don't have data to inform our interventions. We don't know how many girls are pregnant. We don't know how many girls are child mothers. We don't know how many girls have been reached with services. We don't know the kind of services that these girls want. So we are building a system which is going to be a data tracking system. That data in the system should be able to tell us how many girls exist in a particular, how many children, not only girls, how many children are in this village, how many are this age, what kind of services do they need, where are the vulnerable children, what makes them vulnerable, how do we intervene? And when we intervene with services, the system is able to tell us this child, Lydia Najemba, has been served with this particular service. This one has dropped out of school as a result of this. So we find means of returning the child to school. So we are working on that management information system now. We have successfully merged the South 116 with violence against children and GBV. So now the call centers receive cases for both gender-based violence but also violence against children. We know how the two are interrelated. Violence against children leads to GBV, but also GBV leads to violence against children. Children who have grown up in violent households also ultimately become violent when they grow out. GBV forces children out of their households and they opt for marriage, they get pregnant, all sorts of cases. They go to the streets, it leads to all cases of child abuse. We have finalized consultations on developing the National Action Plan on ending online sexual exploitation and abuse, and the action plan will soon be out because we have observed that internet is good, yes, but it is doing a lot of harm to the children. Because the children are able to access phones, I can see even our girls here have phones. Some are even on their phones when I'm speaking to them. Yes, that is how harmful the phones have become. Yes, so these children tend to learn a lot of bad content from the mobile phone. And because of COVID, we just couldn't do our way because of that online learning. So we are now developing that action plan on how to go about supporting our children. Yes, we all know that birth registration is right now at 66%, courtesy of NIRA, which is a great achievement, because it gets very hard for us when children don't have birth certificates to pursue those cases in court. The parents will find all means of lying about their children's ages. So when we get to 66% and above, yes, that is in the positive direction. Next. Yes, we have finalized consultations for the National Justice Strategy. We have been able to disseminate the National Child Policy in 128 districts so far, 128 districts and 2 cities of Gulu and Masaka. We have established the child well-being committees, which are bringing together all key stakeholders in the district to deliberate on issues of child care and protection, and we have developed child protection service delivery standards for local governments. We have done this in collaboration with Ministry of Public Service. Next. Yeah, my colleague Ruth has just arrived. I just told you they were just in northern Uganda. We have the National Parenting Manual and the national standards for the parenting programs. That's what I told you, they were conducting TOTs to the cultural institutions. We have trained over 300 already on the National Parenting Manual in 27 district local governments. And we continue also to provide livelihood programs that we are all very well conversant with, as mentioned above, including the UEP YLP, which is housed in Ministry of Gender, Labour and Social Development. The GROW project is coming up. It is all for supporting households economically so that they can be able to take care of their children. Because we know that one of the leading causes of child marriage and teenage pregnancy is actually poverty in the household. So we are trying to deal with household poverty. Next. Yes, despite all those achievements, we have not gone without challenges. We still have persistent negative social norms in the various communities. When OHT, Honorable Joyce Simpanga, was being buried last week over the weekend, someone made a comment and said she wrote her book, "It is a pity you are a girl." That's what the grandfather told her, because she was very successful, doing a lot of miraculous things. So the grandfather was feeling bad that she was a girl. So those were the years of Joyce Simpanga. But we still have communities today that still feel the same. A girl child is not supposed to go above senior 4, to go above senior P7, to excel in school, because the end result is the kitchen. You know, they still say that in the communities. After all, you'll end up in the kitchen. After all, you have to give birth. When you start childbearing late, you know, there are a lot of still negative social norms which have persisted, which we have to deal with, especially on the girl child. We still have challenges of low community reporting. I've shared with you some of the children that have been able to report through the helpline. But I mentioned those are children. But the relatives they live with were not able to report those cases. The aunties, the uncles, even the parents, but the children themselves picked up their phones and reported. So we still have low reporting in the communities. Some fear the repercussions because when you report, I don't interfere with that family, you know what may happen. They look for you. All those things are still happening in our communities. So we don't know which is which. We don't know, like I already mentioned, we don't have sufficient data to inform programming. Insufficient and untimely data, I talked about that already, but we also have low levels of financing. Honorable Member of Parliament, financing for the social development sector, financing for the interventions to end child marriage and teenage pregnancy. Most of the support we have is coming from the development partners. That's why you had my friend Annette thanking Action Aid here and UNFPA, because they are doing most of the supporting for ending child marriage interventions. But as government, we are inadequately financed. Yes, we still have an issue of low access to services, whereby children have to travel very long distances. There are some districts I've moved to, and you can move a distance of 38 kilometers without seeing a health center, without seeing a school. So we have low accessibility to services, especially in the hard-to-reach areas. The disasters and emergencies have not spared us either, because there are those situations where you'll find the floods have come, so the children have to move. And where they move as emergency support, the areas are terrible. It's hard to avoid on the side of the child. So the issues of climate change resulting into disasters and emergencies have been a big challenge to our efforts to end child marriage and teenage pregnancy. What have we learned as lessons to learn? Next slide, please. Yes, political will is the bedrock to ending child marriage. We need to be supported, right from all levels, from cabinet, from parliament, from every corner. We must be supported. Let every political leader talk about child marriage. Every opportunity you get to talk to your constituents, to talk to your people in your community, please talk about child marriage. Yes? Excuse me? Yes. Data is very important in informing decisions, guiding interventions. We need much more data than what we have to inform advocacy and decision making. Child marriage is a multi-sectoral problem, so we must handle as a team, all sectors on board. We must put culture and religious leaders at the top of everything, especially when it comes to community engagements. We listen to them, we respect them, and everybody will listen to what they say. We must empower local governments, communities, and households to take action in a more sustainable way to end child marriage and teenage pregnancy, because resources will never be enough, so the communities have to come up. We shall continue crying of limited resources all the time, but we must use the available community interventions to end child marriage and teenage pregnancy. Thank you very much.
Wow, a round of applause to Lydia there. Thank you, Lydia, for a job well done. You brought us up to speed with what we are doing in terms of implementing that program. Ladies and gentlemen, in a special way, may we welcome our chief guest, the Minister for Gender, Labour and Social Development, in charge Children Affairs, the Honorable Sarah Mateke Irabashitsi. You're most welcome, Honorable. Good to have you here. Honorable, we have been here since morning, and we have converged to do nothing but to talk about teenage pregnancy, child marriage and teenage pregnancy in our country. And you found your staff, Lydia, was delivering a status quo about the program to end the two vices. You'll allow us to move to the next presentation before we move into the moment of speeches. This is going to be a testimony of a beneficiary from Nakapiripirit who will deliver testimony. Then after there, we launch into the official opening ceremony. So, Nakapiripirit District Representative, please come and take the microphone and do your presentation. Let's give them a round of applause as they come here.
Yeah, good morning, everybody. I am Dennis Athio, the DCDO Nakapri Prit. Before me, I have come with 3 teenage mothers, and I will request one of them to give us this testimony as we are here today for them. Thank you so much.
Good morning, everyone in the house. I'm very happy today, and I thank God for having brought us all safely. I'm called Abra Fatuma, and I'm 20 years old. I come from Namalu sub-county, that is the under Nakapiriprit district. I'm very happy for what Action Aid is doing to our lives as young mothers. It's not easy. Like when you get pregnant at a young age, it's not easy. Even the community will abandon you. So as a young girl, I grew up when I had all my parents. I think all of us know what broke out in 2019, the issue of COVID. So I was at school in my senior 3. They could not inform me that COVID has claimed the lives of all my parents because I was still at school. When I came back, I found that COVID has really taken their lives. And behind me, I had 3 boys, my brothers, and I'm the eldest. So even my other relatives abandoned me, and I remained alone to take care of them. And you know, being a young child and you're taking care of your other brothers, it's not easy. So I started washing people's clothes as well as fetching water to earn a living. I continued, and the little money I used to get from that, I used to save that money. That money enabled me to start brewing, which I'm doing even up to now. But all that, there was still a challenge, because that little money could not sustain the lives of these 4 brothers of mine. This forced me to sleep with my boyfriend who gave me a pregnancy, thinking that this boy was going to help me take care of these boys. I got pregnant, and remember, I got pregnant when I was very young. When it reached time of giving birth, I was operated. And the worst of it, he also ran away, dumping me with again 1 child. My life was not good. I continued washing people's clothes as well as fetching water. When this business of brewing also was there. So I continued with it till I developed a skill of making these skirts, which we are putting on. I request my colleagues to stand. You see those skirts? I make them, then I take to the tailor to put a belt. You first stand up. This is a belt. This one. But this downer side, I'm the one making it. But all this is not satisfying. That was not what I was meant to be when I grew up as a child. My vision was to become a midwife, and I really longed for my vision, anyway, to fulfill what I longed for. I request for support, and I really need to go back to school. Because when a child is educated, more so when a girl is educated, the whole nation is educated. My advice to other girls who are outside there, to teenage mothers, this is not the end of life. Even if you are carrying a child, you still have a chance to go back to school to accomplish what you aimed, what you wanted to become in life. Do not lose hope, but keep on and try to go back to school. Even me, I want to go back to school because I'm still young. A child cannot stop me from going back to school to achieve my dream. I request for support. Thank you.
Thank you so much for that testimony, please. Yeah.
Yeah, thank you so much. Because of time, otherwise the rest also had similar experiences, and we just decided to choose one. Thank you.
Thank you so much, our children, for sharing with us your experience. And we would like to thank all those that have been support systems to you through this challenge. And we pledge to continue being of support to you and other children that find themselves in situations like those. In any case, your story is the reason why we are here this morning. Ladies and gentlemen, we are going into a session of remarks, and I was reminded by my colleague that we missed one key point, which I don't want to miss now. I want to request all of us to be upstanding so that we do the anthems and we move on to the speeches. Let's start with the Ugandan anthem. This should have been done immediately the minister walked in here. Apologies. Sound people, do you have, or you want me to lead the choir? O Uganda, may God uphold thee. We lay our future in thy hand. United, free, for liberty together we all rest on. Let's do the East African. Thank you so much. Let's be seated. Honorable Minister, before we launch into this session, allow me to recognize some of the prominent people here with us. Seated right on your left is the Honorable Opendi Sarah, Chairperson WOPA, your colleague. We also have here with us from UNFPA, the representative, Laura Lofuete, who is representing UNFPA. We also have here with us other partners, a host of them that we work with, CSOs. We have district local governments represented here by the chief administrative officers, the DCDOs. We also have child mothers represented here, as you've just seen from the last testimony there. But more importantly, we have representation from the districts of Kwen, Kapchorwa, Bukwo, Kitugum, Gulu, Amudat, Nakapiripirit, Moroto, and Omoro. All these are here with us. We also have the civil society partners here with us. We had the Executive Director, Action Aid Uganda, here with us, Mr. Xavier Joyi. He just moved out for another engagement, but he will be joining us shortly. Honourable Minister, I know that you don't have much time, and therefore you allow us move into our speeches as lined up. And I take this opportunity to invite the representative of the Permanent Secretary, Minister of Gender, Madam Annette Kabarenji, to come and deliver the PSC's remarks. A round of applause to her.
Our Honorable Minister, honorable members of Parliament, the development partners, the district local governments present, the civil society stakeholders and cultural institutions, the media fraternity, ladies and gentlemen, I welcome you to this very important meeting of looking at the plight of the girl child, our child, the mother of Uganda tomorrow. We are holding this symposium in relation to our national strategy for ending child marriage in Uganda, which is also building on other legal and policy frameworks geared towards protection of the girl child and ending gender inequality and women's disempowerment in Uganda. The theme of our symposium today is translating laws and policies into appropriate support services for pregnant girls, child mothers, and their babies. This is providing opportunity to us, stakeholders, to reflect on the plight and realities of pregnant girls and child mothers, as well as their babies. It is also an opportunity to facilitate us assess our progress towards protection of the rights of the girls and children, but also build consensus on strategies to address the existing gaps in our society. Ladies and gentlemen, Uganda has not done very well regarding teenage pregnancy and child marriage. We have only scored 1 mark from 2006, from 25% and to the current, which is 24%. Statistics that are not good for anyone to witness, but statistics that reflect that we still have a lot of work to do in protecting the girl child in Uganda. The ministry, with support from different development partners, but specifically from UNFPA, which is present with us here today, and UNICEF, we have been able to take steps in the legal and policy directions to ensure that our girl children are protected. And one of them is the National Strategy for Ending Child Marriage and Teenage Pregnancy, 2022-23 to 2026-27. And that is the strategy under which we are implementing our activities for ending child marriage and teenage pregnancy. But similarly, under the support from UNFPA, we are implementing the UN National Ending Child Marriage program. And we are getting support that we are giving to 10 different local governments for addressing child marriage and teenage pregnancy. And under this arrangement, we are specifically focusing on developing bylaws and ordinances that facilitate the process of getting pregnant, but also destabilize the communities where these girls grow from. The strategy for ending child marriage focuses on strengthening girl-child protection mechanisms at various levels, both national and district level interventions. And our purpose is to eliminate gender inequality by 2030 but we have already scored badly. We may not achieve this if we do not put in place strong mechanisms, including mechanisms that will bring us together to work holistically, but also work in a comprehensive manner. We seem to be scattered. True, our resources are not sufficient, but when we get resources from development partners, I think we need to get harmonized and stop putting ropes for scarce resources, which resources are meant for our daughters. That's why, as the Minister of Gender, the coordinating agency, we feel we need to get together. When you get together, you do too much with little. And when we get together, we build on each other's synergies. And when we get together, we do mutual accountability because you know you are answerable to one another. So we are grateful for the representation in the boardroom because we are people from diverse backgrounds representing the government as well as the non-state actors who support us in running our mandate. So I have a call, a simple call. It's a simple speech, but it's a simple call. Can our duty bearers play their part? In ending child marriage and teenage pregnancy, everybody has a role. Can we play our role and reflect on our performance? Can we allow to be accountable to some level? You don't simply get resources to do what you want. You need to be accountable. If you are a CSO operating in a local government, you need to be accountable to that local government. They need to know what you do, where you do it, how you do it, because they are your overseers. Now, for the government MDAs, we need to reflect on our performance in the different structures of government that we have put in place. We have the National High-Level GBV Policy Dialogue. It is chaired by the Honorable Minister to discuss issues that are pertinent regarding GBV and violence against children. Can we reflect our performance there? And if you are not a member of the GBV Policy Dialogue, at least be part of the GBV reference group. This is a technical team that brings together the different stakeholders so that we can look at GBV comprehensively. And if you can't, at least be a member of the National Medical Legal Task Force so that we can look at elements of generating evidence for GBV and VAC. And if all that cannot work for you, at least be a member of our national outcome coordination meetings. We want to know where you are. We want to know what you do there, how much of it contributes to our mandate, so that we can collectively know at a glance how we are faring. UBOS gives us statistics, but it does not give us that qualitative good information that we social workers and gender experts want. 24 is statistics, but what is 24 if we unpack it? In terms of how many girls live in their homes, how many girls are vulnerable to child sexual abuse, how many girls are vulnerable to the social media, and the rest of it. How many of those girls are in their homes alone, the way she has just described? It's only when we come together as a team that we are able to know the meaning of the statistics that we are looking at. Statistics are what they are, but behind statistics, there is a lot of information. So we need your commitment as we get together to communicate, to coordinate, to identify gaps, and to support each other in this synergy, because we still have a long way to go. So as I conclude, Honorable Minister and the rest of the delegates, including our development partners, I wish to call upon all of us to strengthen our collaboration and coordination. Once you have very little money, you have a neighbor who has some more money. You have some other neighbor somewhere who has some more money. So collectively, we shall be able to address the vice of teenage pregnancy and child marriage, and we shall also be able to address GBV more comprehensively than we have done it before. I thank you very, very much and welcome you to this meeting. Thank you.
Thank you so much, representative of the Permanent Secretary, Minister of Gender, Labour and Social Development. Honourable Minister, also here with us, allow me to recognize the presence of other partners we work with. We also have here, Madam Annette talked about the European Union. From European Union delegation, we have Mr. Kamsime Thomas representing. Thank you for coming. A round of applause. And from JELOS, we have Madam Lucy Ladira there with us. And also allow me to recognize the presence of Madam Luta Shaba from the Spotlight Initiative, the coordinator herself. Allow me invite our next speaker, and that will be Laura representing UNFPA. Please, Laura.
Honorable State Minister for Youth and Children Affairs, Sara Mateke. Honorable Sarah Ching Opendi, MP, Chairperson of Uganda Women Parliamentary Association, other members of the Parliament, senior government officials from Ministry of Gender and other MPAs, representatives from civil society and private sector, media, representatives, my UN colleagues, and especially girls and boys here present. Let me acknowledge especially Abura Fatuma for standing here and putting a face of this hard situation of teenage pregnancy and child marriages. Ladies and gentlemen, good morning all. I am honored to stand alongside each one of you here today as we reflect upon our progress, taking stock of what has proven effective and acknowledging the immense work that remains to ensure that every girl's potential is fully realized. Before I jump into reading the statement from our country representative, Gift Malunga, allow me to acknowledge the leadership of Ministry of Gender under the Honorable Minister, Sara Mateke, in terms of developing and implementing the child marriage and teenage pregnancy strategy, and the critical role that they have played in terms of coordination of the different stakeholders. As I think we heard from Annette, we have been implementing with UNICEF the second phase of the global program to end child marriage for the last 5 years. And this symposium is coming at the key time where we are reflecting what we have achieved and what are still the gaps where we need to accelerate our efforts. And this is a reflection as we are designing the next phase 3 for the global program that will run 2024 to 2030. So it's key to be here, it's key to learn from all of you, especially the representatives from the district level and all stakeholders, so we make informed decisions moving forward. We take stock and we learn what has been keeping an impact and what we need to change to accelerate our efforts. So let me acknowledge especially our focal points, Lydia and Annette, for the coordination and action aid of this symposium. And I hope that we will be learning together and continue our efforts. So allow me to read on behalf of the representative the statement from UNFPA. I am honored to join the people in this room where we stand in an unwavering belief that child marriage, early marriage, forced marriage, and all other harmful practices should end now. Our purpose of gathering here today echoes this year's theme for the 16 days of activism that was launched last Friday in Kiriandongo with the leadership of the Ministry of Gender. Unite, invest to prevent violence against women and girls. We are guided by the fundamental principles of international human rights and the Constitution of Uganda, to which every individual is rightfully entitled. Every girl has the inherent right to be a girl and not a child bride. Every girl has the right to live a life untouched by the harmful practice of female genital mutilation. Every girl has the right to access health care, including sexual and reproductive health. And nonetheless, every girl has the right to choose whether to have children or not, to decide freely the number, spacing, and timing of children. Everyone has the right to be able to get the information, education, and support to make these decisions. However, despite these inherent rights, those atrocities continue to plague Uganda and the world at large, as we have seen from some of the statistics that our colleague Lydia was sharing this morning. Estimate guest, Honorable Minister, great gains have been made towards ending child marriage in Uganda, including the development of the teenage pregnancy and child marriage strategy that we were taking stock this morning with the presentation. However, we must acknowledge that we need to accelerate our efforts and ensure our approach includes everyone, especially the most vulnerable girls in all their diversity. We heard this morning some statistics in terms of what we have achieved, policies, parenting guidelines, but the statistics from Uganda Demographic Health Survey, they are still telling us that a lot more needs to be done. At the current pace, we shall need more than 300 years to end child marriage. And I don't think we have the time, as we will lose a number of generations. Recent progress has been vastly unequal and hampered by a confluence of challenges, including what we call the polycrisis. And we mean about the climate change impact on girls and young women, like floods, drought, as well as mega trends such increasing food insecurity as we see in our Karamoja region, fragile and humanitarian situations with the refugee flooding in the northern region, and the effects of COVID-19 as we heard from our testimony this morning. And their investment in ending child marriage and a growing number of conflicts with far-reaching consequences. But the polycrisis is not the only block that we have in front of us. Globally, and also in Uganda, we are seeing a pushback on gender equality outcomes. We cannot afford to rest when the girl child faces the daunting obstacles compounded by existing pushbacks such as unequal access to education, lack of bodily autonomy, inadequate medical care and survival prospects, unequal legal protections, lack of economic equality and opportunities entrenched in societal mindsets. Allow me to quote our global UNFPA Executive Director, Dr. Natalia Kanem, during her statement on 11th of October during the International Day of the Girl Child. She said that the 10-year-old girls of the world are still waiting for us. They are waiting for us to put aside our differences, find common ground, exercise joint leadership, and help them. They want to finish their education, stay healthy, avoid the calamity of unintended pregnancy, and they want us to help them reach their infinite potential. And I think we heard the same call to action from Abura this morning. This is a call for us to focus on a multi-sectoral approach to make girls thrive. I think we listened to Annette as well, calling all of us to be accountable in our roles and responsibilities as different stakeholders, that we should coordinate and come together to end child marriage. We should reflect, as Annette has called us, in our performance. How are we implementing the national strategy to end child marriage? And what are the gaps that we can do better? Therefore, increase and targeted investments in sexual and reproductive health services, including access to information and access to contraceptives, appropriate sexuality education, life skills development, and timely parenting skills will equip adolescent girls with the tools to make informed decisions about their bodies and lives, as well as empowering them as agents of change and future leaders. We will not achieve the demographic dividend if we don't invest on girls and boys now. Also, investing in youth-led initiatives through coalitions and partnerships, targeting those left behind, particularly girls in rural communities, girls with disabilities, and those in humanitarian settings, is crucial to ensure that no girl is overlooked. We heard as well from the representative of the PS that the resources are very limited. So we really need to ensure that we prioritize those girls that are more vulnerable. And we have the data, Annette. We can share that data. We can discuss with UBOs, and we can commit to prioritize the most vulnerable girls within this scarcity of resources. We must not rest until the world upholds the inherent rights of every girl child. If you change her life, you can change the world. The call to action echoed during the commemoration of the Day of the Girl is a call to action for all of us to act faster and more boldly. Together, we must ensure that every girl, regardless of her circumstances, grows up safe and secure, knowing that her body is her own and her future is hers to chart. We must facilitate the girls' access to school, healthcare, and life free from violence in order to realize their infinite possibilities. We must also work with boys to foster a generation of men who will be the first to neither perpetrate nor tolerate violence against women and girls. We are talking about patriarchy values when we are talking about ending child marriage. The ones that are holding the power are the men. If we don't with men, so they share the power with the girls and young women, we will never achieve gender equality. So this is why it's key to continue to work with our main champion and ensure that they become more and more every day. Now is the time for action. We must accelerate our efforts to end child marriage and teenage pregnancy. We saw the statistics about 1 in 4 girls get pregnant before 19 years old. And if we continue at this pace, we will not achieve the 2040 vision. National Planning Authority has already informed the government about what are the 3 key investments to achieve Vision 2040. And reduction of the fertility rates up to 2.5 is one of the keys. If we continue to have the teenage pregnancies and these high fertility rates, we will not achieve, as Uganda, where we want to be by 2040. So the time to act is now. We must reflect that when we have 1 in 3 girls married before the age of 18, they are condemned to poverty, and still we will not achieve Vision 2040. We must act when HIV prevalence is almost 4 times higher among young people, and especially girls aged 15 to 19 and 20 to 24 in Uganda. The government of Uganda and partners have made significant progress in addressing the challenges faced by the girl child. We learned this morning about the progress the government is making on implementing the national strategy to end child marriage and teenage pregnancy that provides a clear direction and prioritizes key actors involved in ending child marriage. The revision of the teenage pregnancy in school settings in Uganda is another example. The sexuality education framework for in-school demonstrates a commitment to providing adequate education for girls, as we await from Ministry of Gender, Honorable Minister, the approval of the out-of-school guidelines. To complement the government efforts, different stakeholders are also supporting various interventions. We have representatives from the EU Spotlight initiatives. I talk about the global program on ending child marriage. We are also coordinating with the Ministry of Gender the global program on female genital mutilations. We are working with the Embassy of Netherlands, implementing a program in West Nile and Acholi for adolescent health that is known as ANSWER. We are implementing with the Embassy of Sweden the joint program on gender-based violence that we had the symposium 2 weeks ago nearby in Muñoño, and the Denmark program as well in the West Nile, among many others from USAID and other development partners. While we acknowledge those efforts, it is important to recognize that progress remains slow. The symposium is an opportunity to reflect and learn what are the high-impact interventions we should prioritize to scale up. We must accelerate our efforts to ensure that every girl in Uganda has the opportunity to reach her full potential and live a life free from child marriage, teenage pregnancy, and gender-based violence. As I conclude, on behalf of UNFPA, UNICEF, and the UN system, allow me to reaffirm our commitment to partner with you, all of you, ministries, and also civil society, and especially the girls and boys here represented, to support the achievement of the ICPD program of action, upon which the success of the 2030 agenda also depends. The government of Uganda is committed with the ICPD program of action, and we will continue to work together to achieve its commitments. Let us continue to build on the substantive discussions and on the momentum generated today and during the 16 days of activism against gender-based violence to walk the talk and accelerate the implementation of the strategy to end child marriage and teenage pregnancy in Uganda. The rights of girls require concerted efforts, as we heard from Annette, and those partnerships and collaborations are key to our journey and transformation. And allow me to call here the district stakeholders. We are really much looking forward to see the coordination at the district level. We are very much looking forward prioritizing at the district level, targeting the most vulnerable girls with this scarcity of resources. We will rely on you for the phase 3 of the global program 2024-2030 to ensure that you will prioritize and invest effectively and coordinate with all stakeholders to ensure that an accelerated effort will achieve the impact that we are looking for. We have a collective responsibility to finish the unfinished business and to fulfill the hopes and dreams and shared vision for a future in which no young person and no individual should be left behind. Thank you so much for your listening.
Thank you so much, Laura, from UNFPA, for those remarks. UNFPA is a very good partner to the Ministry of Gender, Labour and Social Development in various programs, and this is one of those areas where our collaboration is very, very, very strong. Ladies and gentlemen, as Laura was delivering her remarks, we are glad to be joined by the Ambassador of the Royal Kingdom of the Netherlands to Uganda. You're most welcome, Your Excellency. And unfortunately, I will not allow you time to catch your breath. I'll straight away invite you to deliver your remarks, because after you, the Honorable Minister will be speaking to us. I welcome you. A round of applause.
So, good morning. It's good to see a full house today. Distinguished guests, honorable ministers, all protocol observed. My name is Karin Boven and I'm the ambassador of the Netherlands here in Uganda. And thank you, Ministry of Gender, Labour and Social Development, UNFPA, UNICEF and Action Aid for organizing this timely event. We are still in the first week of the 16 days of activism against gender-based violence with the theme Invest to Prevent Violence Against Women and Girls, #NoExcuse. It's appropriate to dedicate a day for a strategic discussion on child marriage, which, together with teenage pregnancies, is a major and constant concern in Uganda. And as you are all aware, in Uganda, 34% of the girls get married before their 18th birthday. According to Ugandan law and according to African and global rights declarations, this is a violation of rights. But despite these laws and declarations, and despite the common agreement that child marriage is wrong, it has remained a common practice in Uganda, affecting 1 in 3 girls. And these numbers tend to numb us. To let that number sink in, 1 out of 3 girls, seated here today, this would mean that one of your neighbors is affected, or yourself. Try to imagine looking around, 1 in 3. Try to imagine how this would affect your life, or the life of your wife, your daughter, your sister, or your female friend. The previous speakers have undoubtedly discussed the consequence of this violation for girls, for their families, their communities, and for the country as a whole. I'm convinced they expounded on the multiplicity of root causes, the diversity of duty bearers, and the struggle with impunity and accountability. Yet, despite the complexity of all these factors, we all agree that child marriage needs to end, and we all commit ourselves that there is no excuse, not for the practice itself, neither for inaction nor impunity. So, if we all agree that child marriage needs to stop, our job is to come to a common agreement on how to end it. For the Netherlands and for Team Europe, the elimination of gender-based violence and improvement of sexual and reproductive health and rights are key priorities. Equality between women and men, girls and boys, and leaving no one behind is a core component of our foreign policies. And I'm very proud to say that the Netherlands is a global champion of preventing and ending child marriage and has provided almost 100 million euros in funding over the past 5 years. This includes, for instance, support to the UNICEF-UNFPA global program against child marriage. And here in Uganda, we contribute to the fight against child marriage and teen pregnancies through our programs with UNFPA, AMREF Uganda, and through our support to several civil society organizations. As the Netherlands, we remain, to conclude, dedicated, contributing to ending child marriage in partnership with all our stakeholders in Uganda, together with the government, to drive the stagnating indicators down and to stick to our commitment. No excuse. Thank you.
Thank you, Excellency, for your remarks. Another round of applause to Excellency as she makes her way. Ladies and gentlemen, I now want to take the singular honor to invite the Honorable Minister to speak to us and officially set us rolling. A round of applause as she gets here.
Honorable members of parliament who are here, Your Excellencies, the Ambassador, I've seen the Ambassador of the Royal Ambassador of Netherlands, the representatives of the UN Resident Coordinator, representative of the UN agencies, representatives of the diplomatic missions, representatives of the government ministries, departments and agencies, all those from local governments, representatives of civil society organizations, the media fraternity, distinguished ladies and gentlemen, good morning. Hey, you're hungry? Good morning. Oh, you're very sad, because when we are talking about teenage pregnancy and child marriages, people get annoyed. So you may be annoyed. It is a pleasure and honor to welcome everyone present to this very important symposium, and thank you so much for honoring our invitation. This has been very timely since we are within the 16 days of activism. This is our second national symposium on ending child marriage and teenage pregnancies that brings us together as key actors to deliberate on issues pertaining to the plight of teenage mothers in this country. This symposium demonstrates the achievements we have registered as a country. I know we are moving slowly, but of course we are here to register some of the achievements that we have registered as a country towards the service delivery for the teenage mothers and their children, including re-entry in school, access to justice, child care and protection, maternal health and nutrition, among others. This platform serves to dialogue on the level of support and implementation registered by several stakeholders by giving accountability and an opportunity to strategically discuss issues that affect the plight of the girls of Uganda and also issues that affect their future as we perform our roles and responsibilities as duty bearers. Ladies and gentlemen, the symposium is commemorated under the theme, Translating Laws and Policies in Appropriate and Sustainable Support Services to Pregnant Mothers or Pregnant Girls, Child Mothers and their children. This gives us the opportunity to assess and discuss the progress made towards promotion of the rights and dignity of the girls and their empowerment in Uganda, strengthen their existing interventions, and identify new strategic ones to accelerate the service delivery. The rate of teenage pregnancy in Uganda has stagnated over the last decade at the rate of 25%, as our colleagues had already mentioned. In 2006, then 24% in 2016, and a surge recorded during the COVID-19 pandemic. According to UDHS 2021, the country recorded 31,565 pregnancies every month, which translated to 1,052 pregnancies recorded daily. 1 in 4 girls, 25% of the girls in Uganda aged between 15 and 19, have a child or are pregnant. 34% of the girls are married before making 18 years, as you have already heard others talk about it. Although numbers are rising, no evidence has been generated on possible remedies to address the challenge, especially reliable, real-time data to support evidence-based programming, resource allocation, and targeted interventions in prevention and response. Ladies and gentlemen, Uganda has put in place strong laws and policies for eliminating all forms of discrimination against women and girls, including outlawing negative practices. The 1995 Constitution outlaws all forms of discrimination based on gender, religion, ethnicity, and economic status, among others. Our Constitution emphasizes gender equality and recognizes the significant role that women play in society. It guarantees women and girls the right to full and equal dignity with men, and also mandates the state to provide facilities and opportunities to ensure the welfare of women and protection of women's rights, considering their maternal functions and the several roles played by women in the socio-economic transformation of society. Uganda is a signatory to a number of very important international and regional instruments for promotion of gender equality and women's empowerment, including the 1995 Beijing Platform for Action, the African Charter on the Rights of Women and Girls in Africa, the Convention on Elimination of all forms of discrimination against women, and the Sustainable Development Goals, among others. Uganda has domesticated these instruments in its laws, policies, and programs, resulting into a well-aligned vision on gender equality and women's empowerment. Before I conclude, as the representative of the PS was talking, she said that we all have a role to play to end child marriages and teenage pregnancies. It all starts with me and you. Whenever I am addressing issues to do with teenage pregnancy, I always say I wish you would value our families, value parenting. I think it all starts from our families. It all starts from parenting. We may talk here, put in a lot of money, but if we cannot strengthen our families, if we cannot strengthen that institution, and of course strengthen even the skills of parenting, we may not go very far. Of course, there are many issues. We are talking about this, but when my colleague was moving out, Honorable Sarah Opendi, she said I should apologize that she has to go and present her bill on alcohol. And she said, you people, you should also now talk about what alcohol is doing to our children. They normally put it on those, do not sell to children below the age of what? 18. But how many children go to the bars and are given alcohol? After taking the alcohol, they end up in the wrong places. And leave alone alcohol alone. Even these drugs also disorganize our boys and girls and end up in the wrong places. Finally, I would also say that it is also important that we also give an ear to these young girls so that they have the justice. I think I was delayed because there's a young girl who came to my office today, and she was telling me how she was defiled, how she took the case to court. The file disappeared from the DPP's office. So just before I came here, this is a young girl, she wants justice, but somebody is denying her the justice. So can we all who are here in your relevant offices give an ear to these young girls? Give them a second chance. These girls can be somebody tomorrow. As I conclude, I wish to thank the government, development partners, the UN family, and civil society organizations who have supported and continue to make contribution towards the programs to end child marriage and teenage pregnancies and all forms of gender-based violence in Uganda. We really want to appreciate. We don't take it for granted. I once again thank you all for honoring our invitation, and I look forward to fruitful deliberations. Thank you so much for God and my country.
Thank you so much, Honourable Minister, for those remarks and bringing the point home Honourable Minister, we are going to request that we do a photo opportunity before we break off for our tea break. And I'll request the entire table of the Honourable Minister to come up here. Then I'll request other members of the other delegates to stand here as we do some group photos. Okay. I'll start with the district teams who are here. All the district representatives who could come, the cows, DCDOs. You could join the minister here as we do a group photo. I'll be calling some in batches. Let's come and take position as the Honourable Minister and the team gets ready. Your Excellency, please, let's have a group photo. Lucy, Luther, who could stand up on the podium. Other members will stand down. Yeah, you can go up. Yes. Okay, at the count of 3. Okay. The first photo has already been taken. We now take the second one. At the count of 3. Yes, that's the main camera there. The yellow one at the back. You raise your hand again. They see you. There. We are looking at that camera. Okay, 3, 2, 1. Shot. 3, 2, 1, shot. Thank you, district teams. May I request the adolescents and teenage mothers, please come. Adolescents and teenage mothers, please stay. The minister and her team will stay. We shall have different people coming. Adolescents and teenage mothers, please come. Come running. Stand down again. Take position here. This is going to be a beautiful photo. New Vision, Daily Monitor. You realize I've just given you your front page photo tomorrow. But please cover the faces of all underage children. Whoever is called a child below age 18, publish with concealment of their faces. There we are. 3, 2. Please, let's follow the protocol in terms of taking photos. Are we good? 3, 2, 1, shot. 3, 2, 1, shot. Okay. May I get the MDS, Ministry of Gender, Ministry of... Please come as the civil society prepare. MDS, Ministry of Gender team, Ministry of Defense, Ministry of Education. Stand up. Commissioner can go up. Okay, UN partners, please join in this, since the MDAs are not weighing up. There we go. UNFPA, UNICEF, all UN agencies, please join in. Madam Maggie, please. And Madam Maggie, climb up. Please climb up for you. I want to see you very, very clearly. Mr. Xavier is here. This is a good photo to join. Mr. Xavier Joy. Is he here? At the count of 3, 3, 2, 1. Okay, just hold there. Let me allow Mr. Xavier Joy to join. On top, you could stand up at the rear end, the other side. Yes. You know, Action Aid is a very good partner, and I don't want them to miss any photo. Okay, we are now good to go. 3, 2, 1, shot. 3, 2, 1, shot. Is there a group that has not had opportunity? Civil society. Civil society, please come. That will be the last. I can see you. These civil society people, What food do they eat? They eat different kind of food, Okay. If you have not had the opportunity to stand to take a photo, this is the moment. Please come and join. We are counting 3. Very good. Look at the yellow and black camera. At the count of 3, 3, 2, 1, go. 3, 2, 1, go. Very good. There has been a request, Honorable Minister, from the Karamoja cultural leaders. They want a photo. Please, Karamoja Elders Association, please come and do this. This is the last one. Luther, please don't leave. Just one more. Yes. These are our elders from Karamoja. There we go. Yes. The cow, that's right. Please join in. Yes. Anybody else who has missed? We are good. Okay. The girls. Are there girls who have not taken a photo? Please come. Come. Performers join. Join. Performers join. Anybody else? Okay, we're good to go. 3, 2, 1, go. 3, 2, 1, go. I think we're all covered. Thank you so much. A round of applause to everyone. Convoy will do the honor to deliver her quick and safe. For now, ladies and gentlemen, I invite you for break tea. We'll return back with our tea and start off business right away. Thank you so much. Wish you all the best. See you after the break tea in 5 minutes.